It starts off like any other day. You feel fine. Maybe just a bit tired. Maybe your arm is a little numb. You assume you slept on it wrong. You try to shake it off. But what you don't realize is that your brain has already entered a countdown. A stroke is only 10 minutes away. What happens in your brain 10 minutes before a stroke? Let's imagine this moment 10 minutes before a stroke. Your brain is still functioning. You're reading, walking, talking, but behind the scenes, something dangerous is brewing. A stroke is not a bolt of lightning that comes out of nowhere. It's more like an earthquake. Pressure has been building for days, months, sometimes even years. And in those final 10 minutes, the foundation begins to crack. There are two main types of strokes. Ischemic, which accounts for nearly 87% of all cases, caused by a clot blocking blood flow to the brain. Hemorrhagic, caused by a blood vessel bursting and bleeding into the brain. In both cases, the brain is about to be robbed of oxygen, and without oxygen, brain cells begin to die fast. But what exactly is happening inside your brain in those last 600 seconds? At the 10-minute mark, in the case of an ischemic stroke, a blood clot has now nearly or fully blocked an artery in your brain. This blockage didn't come from nowhere. It might have started in your heart, especially if you have atrial fibrillation, or formed right inside a narrowed vessel choked by years of plaque buildup. Blood flow begins to slow dramatically. And this is critical. Your brain cannot store oxygen. It needs a constant supply, every second, or neurons begin to malfunction. In the early stages right now, you may not feel much. Maybe you drop your coffee cup and wonder why your hand didn't grip it properly. Maybe your speech feels a little off. These are subtle signs, and tragically, many people ignore them. By minute 8, the first patches of brain tissue have begun to suffer hypoxia, oxygen starvation. Without oxygen, cells can't produce ATP, the energy currency of the brain. Electrical activity slows, neurotransmitters misfire. You might feel confused. You might have trouble speaking. Or maybe you just feel off. You can't quite put your finger on it. But inside your brain, the damage has begun. Every minute without treatment, nearly 2 million brain cells can die. That's not just a number. That could be the cells responsible for your memory, your ability to walk, your sense of self. Now we enter minute 5. This is often the moment when visible symptoms begin. Your face might droop on one side. You might lose control of an arm or leg. Words might come out slurred or scrambled. These are classic signs, and they're your brain's cry for help. Why do these symptoms appear? Because specific regions of your brain are shutting down. If the stroke hits your motor cortex, you lose control of muscles. If it affects Broca's area, you can't form clear speech. If the parietal lobe is involved, your sense of balance or touch might go haywire. The location of the clot or bleed determines your symptoms. And remember, the brain is wired crosswise. A stroke in the left hemisphere affects the right side of your body and vice versa. As we close in on the final 3 minutes, your brain begins to adapt in panic. Nearby blood vessels dilate to try and send more blood to the oxygen-starved area. Collateral circulation, alternate routes of blood flow, attempts to compensate. But it's often too little, too late. Some neurons release excessive amounts of glutamate, a neurotransmitter meant to excite, but in excess, it becomes toxic. It damages nearby neurons. A chain reaction begins. It's called excitotoxicity, and it accelerates brain damage. You may start to feel dizzy, disoriented. You might collapse. This is a medical emergency. And then, the final moment. Blood flow completely stops in part of your brain. The cells in that region begin to die en masse. You may lose consciousness. You may experience a seizure. Or you may be awake but unable to speak, move, or understand what's happening. The damage has begun, and every second counts. But here's the good news. There's still hope. If someone recognizes the signs and calls 911 immediately, emergency medical teams can administer clot-busting drugs like TPA or even perform a mechanical thrombectomy to physically remove the clot. But the window is short. That's why understanding what happens before a stroke is just as important as treating it after. Let me tell you about Richard, a 8-year-old retired teacher. He was at home, making a sandwich, when he suddenly felt weak on his left side. He thought maybe he was dehydrated. He sat down, drank some water, and waited. His wife came home 10 minutes later. She noticed his smile was uneven. His speech slurred. She knew the signs and called 911 right away. Richard had a stroke, but because they acted quickly, doctors were able to administer TPA within the golden window. He made a nearly full recovery. But not everyone is as lucky. We often imagine strokes as dramatic events, sudden collapse, slurred speech, paralysis. And yes, they can happen that way. But in many cases, the body whispers before it screams. These are called transient ischemic attacks, or TIAs, often nicknamed mini-strokes. They're caused by a temporary blockage that clears up on its own. Symptoms may only last a few minutes, but they're red alert warnings that a full-blown stroke could be just around the corner. TIAs are your brain's way of saying, "Something is wrong. I need help." Here's what to watch for. The easiest way to remember stroke symptoms is the word fast. F. Face. Is one side drooping? Ask the person to smile. A. Arms. Can they raise both arms? Or does one drift downward? S. Speech. Is their speech slurred or strange? T. Time. If you see any of these signs, call 911 immediately. Every second matters. Getting help fast can mean the difference between full recovery and permanent disability, or worse. Now you might be wondering, could this happen to me? The truth is, strokes don't only affect the elderly. They can strike anyone, but some people are more at risk than others. Here are some key risk factors. High blood pressure, the #1 cause of strokes worldwide. Atrial fibrillation, AFib, causes blood to pool and form clots in the heart. Diabetes damages blood vessels and accelerates atherosclerosis. Smoking doubles your risk of stroke by damaging arteries. High cholesterol leads to fatty buildup that narrows blood flow. Obesity and inactivity slow down circulation and raise blood pressure. Family history and age. After age 55, risk increases significantly. These aren't just statistics. They're warning signs your brain wants you to take seriously. The good news? Up to 80% of strokes are preventable. Let's talk about how. Control your blood pressure. Aim for 120/80 millimeters or lower. Even small reductions can greatly cut stroke risk. Eat brain-smart foods. The DASH or Mediterranean diets, rich in leafy greens, berries, whole grains, fish, and olive oil support vascular health. Move your body daily. Just 30 minutes of brisk walking can boost circulation, lower blood pressure, and improve brain function. Quit smoking today. Within weeks of quitting, your risk begins to drop. Manage stress and sleep. Chronic stress and poor sleep strain your blood vessels and heart, raising the chance of stroke. Know your numbers. Regular checkups for cholesterol, blood sugar, and blood pressure can spot problems early. This isn't about fear, it's about freedom. The freedom to live fully and confidently. Your doctor can be your strongest ally in stroke prevention. Here's what they might recommend. Blood pressure medication. If lifestyle changes aren't enough, Statins, to lower LDL, bad cholesterol. Aspirin, for some high-risk patients, to reduce clot formation. Anticoagulants, like warfarin or newer drugs, Eliquis, Xarelto, for those with AFib. And don't forget, simple screenings can catch problems early. A carotid ultrasound can detect narrowing in neck arteries. An EKG or Holter monitor can uncover silent heart rhythm issues. Blood tests can check for diabetes and cholesterol imbalances. Taking control of your health isn't just about adding years to your life. It's about adding life to your years. If you or someone you love has already had a stroke, know this: recovery is possible. The brain has an amazing ability to rewire itself, a process called neuroplasticity. With therapy, patience, and support, people can regain speech, mobility, and independence. Support from family, community, and rehabilitation professionals can make all the difference. Never give up on the brain's power to heal. So, what happens 10 minutes before a stroke? A quiet war begins inside your brain. But if you recognize the signs, take care of your body, and act fast, you can stop that war before it ever begins. Stroke is scary, but knowledge is powerful. Share this video with someone you care about. It might just save a life.